ECFMG Practice Test 2026 Educational Commission Foreign Medical Graduates Exam Prep. Question 1. A 65-year-old male presents with sudden onset crushing chest pain radiating to his left jaw. Which is the most likely diagnosis? Pneumothorax, myocardial infarction, gastroesophageal reflux, pulmonary embolism. Crushing substernal chest pain radiating to the jaw or arm is a classic presentation of ME. Question 2. Which of the following medications is a first-line treatment for essential hypertension? Aspirin, lisinopril, ACE inhibitor, warfarin, amoxicillin. ACE inhibitors, ARBs, thiazides, and CCBs are common first-line treatments for hypertension. Question 3. What is the causative agent of strep throat? Staphylococcus aureus, Streptococcus pyogenes, group A strep, Escherichia coli, Haemophilus influenza. Streptococcus pyogenes is the primary cause of bacterial pharyngitis. Question 4. A patient with type 1 diabetes presents with fruity-smelling breath, nausea, and rapid breathing. What is the most likely condition? Hypoglycemia, diabetic ketoacidosis, DKA, heat stroke, heart failure. DKA is characterized by hyperglycemia, ketosis, fruity breath, and metabolic acidosis, small breathing. Question 5. Which organ is primarily responsible for the metabolism of most drugs? Kidneys, liver, lungs, small intestine. The liver is the main site of drug metabolism via the cytochrome P450 system. Question 6. A 25-year-old female presents with a butterfly rash on her face and joint pain. Which laboratory test is most specific for systemic lupus erythematosus, SLE, anti-dsDNA, rheumatoid factor, C-reactive protein, white blood cell count? While ANA is sensitive, anti-dsDNA and anti-Smith are highly specific for SLE. Question 7. What is the mechanism of action of penicillin? Inhibition of protein synthesis, inhibition of bacterial cell wall synthesis, interference with DNA replication, disruption of the cell membrane. Penicillins inhibit the cross-linking of peptidoglycan in the cell wall. Question 8. In the evaluation of a stroke, what is the most important initial imaging test to rule out hemorrhage? MRI, non-contrast CT of the head, X-ray, ultrasound. A non-contrast CT is fast and highly sensitive for acute intracranial hemorrhage. Question 9. Which vitamin deficiency leads to scurvy? Vitamin A, vitamin B12, vitamin C, vitamin D. Vitamin C is essential for collagen synthesis. Its deficiency causes scurvy. Question 10. A patient presents with tearing chest pain radiating to the back. What should be suspected? Aortic dissection, pneumonia, gallstones, asthma. Severe, tearing or ripping pain radiating to the back is classic for aortic dissection. Question 11. Which of the following is a classic sign of meningitis? Nuchal rigidity, stiff neck, pain in the big toe, lower back pain, increased appetite. The triad of fever, headache, and nuchal rigidity suggests meningitis. Question 12. What is the primary treatment for an acute asthma exacerbation? Antibiotics, inhaled albuterol, beta-2 agonist, inhaled corticosteroids, insulin. Short-acting beta agonists, SABA, like albuterol provide rapid bronchodilation. Question 13. A 70-year-old woman has a bone mineral density T-score of -3.0. What is the diagnosis? Normal bone density, osteopenia, osteoporosis, osteoarthritis. A T-score of -2.5 or lower is diagnostic of osteoporosis. Question 14. Which electrolyte abnormality is most commonly associated with a widened QRS complex and peaked T waves on EKG? Hypokalemia, hyperkalemia, hyponatremia, hypocalcemia. Hyperkalemia is life-threatening and causes distinct EKG changes like peaked T waves. Question 15. What is the most common cause of community-acquired pneumonia? Streptococcus pneumoniae, Legionella, Mycoplasma, Pseudomonas. S. Pneumoniae is the most frequent cause across all age groups. Question 16. A newborn has yellowing of the skin and eyes 3 days after birth. If the bilirubin is only mildly elevated, what is the likely diagnosis? Biliary atresia, physiologic jaundice, hepatitis B, ABO incompatibility. Physiologic jaundice is common and usually benign, occurring after the first 24 hours of life. Question 17. What is the goal of informed consent? To make the doctor's job easier, to ensure the patient understands the risks, benefits, and alternatives of a procedure, to prevent all lawsuits, to get the patient to agree to anything. Informed consent is a process of shared decision-making. Question 18. Which of the following is a symptom of hyperthyroidism? Weight gain, cold intolerance, heat intolerance and palpitations, bradycardia. Hyperthyroidism speeds up metabolism, leading to heat intolerance, weight loss, and tachycardia. Question 19. A patient presents with the worst headache of my life. What is the most likely diagnosis? Migraine, subarachnoid hemorrhage, tension headache, cluster headache. A thunderclap headache is the hallmark of a ruptured cerebral aneurysm, subarachnoid hemorrhage. Question 20. What is the first-line treatment for anaphylaxis? Antihistamines, corticosteroids, intramuscular epinephrine, 4 fluids. Epinephrine is the only life-saving treatment for anaphylaxis and must be given immediately.